Go.
We are Group 19, and today we'll be discussing the World Health Organization's global strategy to reduce the harmful use of alcohol. My name is Sonia Kanacheril.
My name is Sheikh.
My name is Esther Shin.
These are our objectives.
We will introduce the problem, we'll talk about the challenges and opportunities, we'll discuss aims and objectives, guiding principles, and describe the policies.
For our purposes, we'll be defining the harmful use of alcohol as drinking that causes detrimental health and social consequences for the drinker, the people around the drinker, and the society at large, as well as the patterns of drinking that are associated with increased risk of adverse health outcomes. Alcohol use is the third leading risk factor for poor health globally and is one of the most common modifiable and preventable risk factors for major non-communicable diseases. Approximately 2.5 million lives are lost each year, secondary to harmful use of alcohol. This equated to about 3.8% of all deaths in 2004. Harmful drinking is a major avoidable risk factor for neuropsychiatric disorders, cardiovascular diseases, liver cirrhosis, cancers, and other non-communicable diseases. It's been associated with infectious diseases such as HIV/AIDS, tuberculosis, and pneumonia. It's also been associated with both unintentional and intentional injuries such as road traffic crashes, violence, and suicide. The degree of risk associated with harmful drinking is affected by other factors such as age, sex, setting and context of the consumption, as well as vulnerability associated with at-risk populations, which increase susceptibility. With this image, we can take a better look at the factors such as societal and individual factors that play a role in determining the health outcomes in relation to alcohol consumption. The issue of harmful alcohol use is not one that solely affects one nation. It's a global problem that needs to be addressed on the international level. It's with this understanding that the World Health Organization initiated the development of a global strategy for reducing the harmful use of alcohol. This global strategy was met with challenges and opportunities. The worldwide trends highlight a need for increasing global action and international cooperation at all levels. Alcohol-related problems are diverse, requiring comprehensive intersectional action. Without appropriate attention amongst decision makers, the spread of harmful drinking practices and norms will continue. The alcohol industry creates employment opportunities and economic and tax revenues for governments. Public health measures and policymakers must then balance these different interests. Poorer societies have lower drinking rates, yet may experience higher levels of attributable harm. Therefore, an emphasis on equity is needed to reduce social disparities. Tailoring of development and implementation of policies to accommodate local contexts in terms of culture and setting, strengthening information via collection, analysis, and dissemination of data, as well as systems to monitor progress made. The World Health Organization has made many great strides in addressing the harmful effects of alcohol use. In 1979, they initiated a program that focused on alcohol-related problems in order to assess the impact of consumption in both developed and developing societies. In 1997, they created the Global Information System on Alcohol and Health, which compiles information on alcohol consumption and related harm by country. In 1999, the inaugural publishing of the Global Status Report on Alcohol took place. And then in 2000, the conduction of a study known as the WHO Comparative Assessment of Risk Factors for the Global Burden Disease revealed that alcohol consumption was ranked as the 5th most important risk factor. With this information, the WHO successfully demonstrated the worldwide public health impact caused by harmful use of alcohol. Between the years of 2005 and 2010, research and development of the global alcohol strategy took place before it was presented and approved at the 63rd World Health Assembly in May of 2010.
I'm going to talk a bit about the aims and objectives of the global strategy for harmful use of alcohol. The vision is improved health and social outcomes for individuals, families, and communities with considerably reduced morbidity and mortality due to the harmful use of alcohol and their ensuing social consequences. The aim is for guidance of action at all levels to set priority areas for global action and to recommend a portfolio of policy options and measures that can be considered for implementation and adjusted as appropriate at the national level. There are 5 objectives that we will discuss. First objective is to raise global awareness of the magnitude and nature of the health, social, and economic problems caused by harmful use of alcohol. Second objective is to strengthen the knowledge base on the magnitude of alcohol-related harm and on effective interventions to reduce and prevent such harm. Third objective will be to provide increased technical support to member states for preventing the harmful use of alcohol and managing alcohol use disorders. Fourth objective will be to strengthen partnerships and increase mobilization of resources required for appropriate and concerted action to prevent the harmful use of alcohol. Fifth objective is to improve systems for monitoring and surveillance. Achieving the 5 objectives will require global, national, and regional actions on the levels, patterns, and contexts of alcohol consumption and the wider social determinants of health. Special attention needs to be given to reduce harm to people other than the drinker and to populations that are at risk, such as children, adolescents, women of childbearing age, pregnant and breastfeeding women, as well as other minority groups.
The protection of the health of the population by preventing and reducing the harmful use of alcohol is a public health priority. The following principles will guide the development and implementation of policies at all levels. They reflect the multifaceted determinants of alcohol-related harm and the concerted multi-sectoral actions required to implement effective interventions. The first is public policies and interventions to prevent and reduce alcohol-related harm should be guided and formulated by public health interests and based on clear public health goals and the best available evidence. Policy should be equitable and sensitive to national, religious, and cultural contexts. 3. All involved parties have the responsibility to act in ways that do not undermine the implementation of public policies and interventions to prevent and reduce harmful use of alcohol. 4. Public health should be given proper deference in relation to competing interests, and approaches that support that direction should be promoted. 5. Protection of populations at high risk of alcohol attributable harm and those exposed to the effects of harmful drinking by others should be an integral part of policies addressing the harmful use of alcohol. 6. Individuals and families affected by the harmful use of alcohol should have access to affordable and effective prevention and care services. 7. Children, teenagers, and adults who choose not to drink alcoholic beverages have the right to be supported in their non-drinking behavior and protected from pressures to drink. And finally, 8. Public policies and interventions to prevent and reduce alcohol-related harm should encompass all alcoholic beverages and surrogate alcohol.
So reducing the risks of alcohol is much more than a public health issue. It's actually a developmental issue. The level of risks associated with the harmful use of alcohol in developing countries is much higher than that in high-income countries. So in order to develop this global strategy, the 63rd World Health Assembly in May 2010 recognized the close link between the harmful use of alcohol and socioeconomic development. This global strategy is endorsed by the World Health Organization, is the outcome of close collaboration between the World Health Organization member states and the World Health Organization Secretariat.
So the
So,
harmful use of alcohol can be reduced if effective actions are taken by countries to protect their populations. Member states have a primary responsibility for formulating, implementing, monitoring, and evaluating public policies to reduce the harmful use of alcohol. Such policies require a wide range of public health-oriented strategies for prevention and treatment. All countries will benefit from having a national strategy and appropriate legal frameworks to reduce harmful use of alcohol, regardless of the level of resources in the country. Depending on the characteristics of policy options and national circumstances, some policy options can be implemented by non-legal frameworks, such as guidelines and voluntary restraints. Some of those measures should be assisted by monitoring impact and compliance, and establishing and imposing sanctions for noncompliance with adopted laws and regulations. Sustained political commitment, effective coordination, sustainable funding, and appropriate engagement of subnational governments, as well as from civil society and economic operations, are essential for success. Many relevant decision-making authorities should be involved in the formulation and the implementation of alcohol policies, such as health ministries, transportation authorities, or taxation agencies. Health ministries have a crucial role in bringing together the other ministries and stakeholders needed for effective policy design and implementation. They should also ensure that planning and provision of prevention and treatment strategies and interventions are coordinated with those for other related health conditions with high public health priority, such as illegal or illicit drug use, mental illness, violence and injuries, cardiovascular diseases, cancer, tuberculosis, and HIV and AIDS.
policy interventions available for national action can be grouped into 10 target areas. Number 1, leadership, awareness, and commitment. Number 2, health services response. Number 3, community action. Number 4, drink driving policies and countermeasures. Number 5, availability of alcohol. Number 6, marketing of alcoholic beverages. Number 7, pricing policies. Number 8, reducing the negative consequences of drinking and intoxication. Number 9, reducing the public health impact of illicit alcohol. And number 10, monitoring and surveillance. We'll discuss each of these target areas in depth as we proceed forward. So number 1 is leadership, awareness, and commitment. So this target area serves to develop or strengthen existing comprehensive strategies to reduce the harmful use of alcohol. Establish or appoint a main institution to be responsible for following up national policies, strategies, and plans. Ensure broad access to information and public awareness among all levels of society about the full range of alcohol-related harm experienced in the community. Raising awareness of harm to others and high-risk groups caused by drinking, avoiding stigmatization, and discouraging discrimination against affected groups. Health services response is also an important target area. The health service response entails increased capacity of welfare systems to deliver prevention, treatment, and care for alcohol use and alcohol-induced disorders, support initiatives for screening and interventions for harmful drinking at primary health care and other settings, improve capacity for prevention of improve capacity for prevention of identification of and interventions for individuals and families.
I'll cut this out. You were doing so good. You started at the beginning of number 2.
Excuse me. Improve capacity for prevention of, identification of, and intervention for individuals and families living with fetal alcohol syndrome and spectrum of associated disorders. Development of treatment and care strategies for alcohol use disorders and comorbid conditions such as depression, suicides, HIV, AIDS, and tuberculosis. Number 3 is community action. This entails identifying gaps and priority areas for interventions at the community level, strengthening capacity of local authorities to implement municipal policies to reduce harmful use of alcohol, mobilizing communities to prevent the selling of alcohol to and consumption of alcohol by underage drinkers, and to support alcohol-free environments, especially for youth and other at-risk groups, developing community programs for high-risk subpopulations such as young people, adolescents, unemployed, and other indigenous populations, discouraging alcohol at the community level, such as sporting events and town festivals where excessive drinking is usually rampant. Number 4, drunk driving policies. So enforcing an upper limit for blood alcohol concentration with a reduced limit for professional drivers and novice drivers, promoting sobriety checkpoints and random breath testing, administrative suspension of driving license in people who are caught drinking and driving, using an ignition interlock system to reduce drink driving incidents, mandatory driver education, counseling, and treatment programs, encouraging provision of alternative transportation, including public transport, running mass media campaigns targeting specific situations such as holiday seasons and young audiences. Number 5, availability of alcohol policies. So there can be strategies to regulate the number and location of alcohol outlets, regulating days and hours of retail sale, regulating retail sales in certain places or during special events, establishing a minimum age for purchasing or consuming alcohol, adopting policies and repercussions for sale to intoxicated patrons and those below legal age, setting policies regarding drinking in public areas, and reducing and or eliminating availability of illicit alcohol production.
The 6th target area is marketing of alcoholic beverages policies. Want to regulate the content and the volume of marketing, regulate the sponsorship activities that promote alcoholic beverages, restrict or ban promotions in connection with activities targeting young people, and develop agencies that surveillance marketing of alcohol. The 7th target area is pricing policies. Regularly reviewing prices in relation to the level of inflation and income, banning or restricting the use of direct and indirect price promotions, discount sales, sales below cost, and flat rates for unlimited drinking, establishing minimum prices for alcohol, providing price incentives for non-alcoholic beverages, and reducing or stopping subsidies for alcoholic beverages. The 8th target area is reducing the negative consequences of drinking policies, regulating the drinking context in order to minimize violence, such as serving alcohol in plastic containers, enforcing laws against serving to intoxicated patrons, reducing the alcoholic strength inside different beverage categories, providing necessary care for severely intoxicated people, providing consumer information about alcoholic beverages to indicate the harm related to alcohol. The 9th target area is reducing the public health impact of illicit alcohol policies, good quality control with regard to production and distribution of alcoholic beverages, regulating sales of informally produced alcohol and bringing it to the taxation system, developing tracking systems for illicit alcohol, and issuing relevant public warnings about contaminants and other health threats with informal or illicit alcohol. The final target area is monitoring and surveillance policies, establishing effective frameworks for monitoring and surveillance activities, including periodic national surveys on alcohol consumption, establishing institutions responsible for collection, analyzing and disseminating available data, including national reports on harmful alcohol consumption-related events, and creating a repository of data at the country level on internationally agreed indicators and reporting data in the agreed format to WHO and other relevant international organizations. So these are some of the components that we wanted to discuss about the global strategies to reduce the harmful effects of alcohol. These are the following references that we use, and we thank you so much for your time.